Doug, I'm excited to tell you about how the Rotator-Reliever system works. Again, this is a daytime, nighttime, but let's start with the daytime and how this exercise, one of the things I like best about it is that you can get it all done in less than 5 minutes. It's easy to do, and it utilizes something we call dynamic stabilization. Now we have a series of weighted balls. I start with the green ball. Okay, and let's have you hold your arm kind of straight out, and we do it 30 ways, 30 rotations clockwise and 30 rotations counterclockwise. Great, that looks perfect. Now, and notice that you've picked it up and naturally are holding your elbow and your wrist pretty stiff when you do this, and that's exactly how I want it done. Now, and that basically is when you do that, that's all rotator cuff that you're exercising. Now, this is not a no pain, no gain situation. If it hurts straight out, okay, then I want you to lower it maybe 2 inches. This should not be a painful form of exercise, okay? No matter what position you've got it in, you're gonna be strengthening the muscles that need to be strengthened, and if it hurts up high, just bring it down a little bit lower. Now, let's have you bring it up another like 45 degrees or so. Good, and we'll do another 30 going forward, 30 going backward, doesn't matter which one you start with. And we've only got 4 of these positions, so hopefully your arm's not about to fall off. All right, so basically we've got 3 positions in this, what I call this plane, and then you've got 1 more position with you bent over the table and exercising with your arm in the dependent position. Now, let me show you, Doug, how these differently weighted balls are. Now, it's important for you to start with the lightest because I don't want you to injure yourself. We're here to heal you. That's why we go 10 days with the green ball. And then you simply take this off. You put the yellow ball on. And this is the system. We bring you up in weight. We progressively make this rotator cuff stronger. Now go ahead and see if you can feel the weight difference there.
Absolutely. Mm-hmm.
Good, and it's going to be a little bit tougher. That's why we have people, slowly get their way up. Now, this our heaviest one is, it's going to be a workout. So, this is days 30 through 40. You use this one. So that's it. That's our ball system. That's how we get the rotator cuff stronger, and that's how we revitalize those muscles so we can take the impingement out and heal that, usually the supraspinatus tendon. So Doug, we've gone over the daytime exercise, how to strengthen the rotator cuff. Now, just as important is how are we going to prevent injury every night? And that's where we have the nighttime brace component. And so I want you to go ahead and try this on.
Okay, so I'm going to take the lower leg cuff and the wrist cuff, separate them.
Right, we call that our quick release mechanism. I see exactly, you put it on below the knee, and Velcroed in there, kind of snug so it doesn't slide up above your knee. All right, so, and this is the wrist component that you're putting on. Obviously this is on the same side, this is the shoulder, same side as the shoulder that's hurting you. You put the quick release mechanism back in there. Easy enough to put on. How does it feel?
Comfortable.
Great, great.
Very comfortable.
I think that in our study we had 0 dropouts from inability to wear it at night. And so I think that the feedback we've gotten is that it's comfortable and tolerable, and you wear it at night for 40 nights as long as you can each night, and this is a key part of our solution. So you're standing next to your bed when you're putting this on, okay? And sometimes I think that some of my patients think more is better, but I would say as far as the traction on your arm, less is more, okay? So this sort of stretch, this pull here, this is an adjustable strap. Basically, it should feel like you're holding a can of corn. That's sort of the amount of pull there. A very gentle traction is going to be enough to open that space up and get this blood flowing to your rotator cuff. So again, you're standing next to the bed, you put that on and go to sleep, okay? And I think that the patients had it on for between 3 and 6 hours at night. I basically tell people, wear it as long as you can at night. And after the first few nights, mostly, they usually get used to it and it's not a problem. And after a few nights, they're going to experience the relief of their shoulder pain, and so they're going to, typically they're excited to wear it. This also, we have you wear for 40 nights, exercise for 40 days, wear this for 40 nights, and it's guaranteed. So Doug, there it is. Now listen, if you're, at night you find yourself, you have to get up to, for whatever reason, we've got our quick release mechanism, and makes it pretty easy, in and out, and that's the ticket. That's the nighttime part. You got the daytime part, and I think that this simple approach heals shoulder pain, and I'm looking forward to our customers trying it. Thank you very much.